right, everybody, we're going to start with Chapter 11, Scene Size Up. And we've been talking about this a little bit and what the different elements of Scene Size Up incorporate and what kind of important information that it can give us. This is an important step in our patient care process. As we've learned over and over again, that our safety is our priority, number one at all times, and this is where it starts with that. And then we get a lot of other information about the patient, their illness or their injuries, and things like that. So let's dive right into it. The scene size up has got several different elements, just like we've seen on our skill sheets there. We have to check for scene safety. We're going to take standard precautions. That means your BSI, whenever that may be, whatever may be appropriate for that call. So right now, what's going to be standard is gloves and masks. And if you need anything else, you'll have to put those on and figure out what it is. Excuse me. We're going to note the mechanism of injury or the nature of the patient's illness and determine the number of patients that we have. And we're also going to figure out what kind of additional resources we may need. What help do we need in taking care of this patient? Scene size up is important because EMS calls can be unpredictable. It's not always a little old lady sitting in her rocking chair in her house. Sometimes we're outside and the weather's bad. Sometimes we're on a road, a busy highway, things like that. Sometimes the patient's condition can change rapidly. Sometimes you find out you have more patients. So they can be unpredictable. And they can pose a lot of challenges and even some dangers there. And so your scene size up is the first part where we're gathering information where we can determine what exactly is happening. So we have to have our antenna up, we have to have our ears open, we have to have our eyes open, and take in as much information as possible when we get to a scene to try to figure out what's going on and how we can remain safe. When we get to a collision scene, when we're getting to the scene, especially a motor vehicle collision is what they're talking about here, we may not be the only emergency vehicle approaching. So we need to keep our ears out for other sirens and the lights and things like that so we can see, excuse me, or hear other patient or other emergency vehicles coming there. You don't want to get smushed by a fire truck because you didn't see it or hear it. We want to be looking for things like power outages. Did a car hit a telephone pole? Telephone pole goes down, power lines come down, that kind of thing. I mean, obviously that's a danger for us. And now we might be able to tell this because maybe a block or two before we're seeing houses or businesses that don't have power. So that might be a sign that power lines are down. We've got to observe the traffic flow. Is traffic completely stopped? Are people like swerving around an accident? Are they going on the shoulder? Are they going into the opposite lane to get around it? Those could pose hazards in and of itself. We might need additional resources like the police department to come and control traffic for us to help keep us safe so we don't have cars driving through our accident scene. On the way to the collision, we can look for smoke, signs of fire. If something's really burning, we may be able to see that from a long ways away before we get there. When you get to the scene or within sight of the scene, we're going to look for signs of if it could be a hazardous materials incident. So not only smoke, but maybe different colored smoke. Is it like a dark yellow? Is it green? Or any other signs like are there lots of birds that are right in the area that are dead? Are there lots of people spread out through the area that are laying down on the ground? Things like that. It gives us an idea of if maybe there's possibly hazardous material. Is there a tanker truck that's overturned? Things like that. As we get closer, we also want to look for other people laying in the road. Did somebody get hit by a car? Are they laying on the ground? Uh, Things like that. Smoke may not be thick and black, or that thick, like really heavy gray color. It may be very light in appearance, and you may not be able to see it from far away. So keep looking for smoke, as you may be able to see some as you get closer rather than farther away. And obviously, like we said, look for broken utility poles and power lines that could be down as well. Be careful. When there's accident scenes, lots of times people like to gather. So there may be people in the road, around the road. There may be people trying to help on the scene. So be alert for people that could be walking in and out of the scene there. Sometimes police or other emergency equipment is already on scene. So as you're approaching, they may wave you in, kind of tell you where to park if you're the one driving. They may give you signals. If it's nighttime, you may see a police officer hold up their flashlight and flash it a couple of times at you to let you know to come in, or somehow signal you there as well. So watch out for other responders if they've gotten there first and giving you directions on where to come and where to go. These people can also obviously help you right when you get out of the ambulance. If they've been on scene, then they have some information that may be helpful for you. When you get to the scene, let's figure out who's in charge. If there's a fire truck there, look for the officer of the fire truck. If it's just like police officers, look for a police officer so we can get some information of what's going on there at that accident scene. Getting out of the vehicle, anytime you're on a road, anytime that you're on the road, doesn't matter if it's a neighborhood road or if it's a highway, you should be getting out wearing the reflective vests or any of your bunker gear that you may be issued. So a lot of times we're issued helmets, reflective clothing, things like that to keep us safe on these scenes. So whenever you're on a road, make sure you're wearing it at the very least a reflective vest, if not more, there to keep yourself safe. It's amazing what people don't see, even though there's big fire trucks or ambulances with lights flashing and things like that. People rubberneck and they're trying to look at the scene of what happened and things like that. I think I've told you guys my very first call. A car missed me by about 6 inches. Someone's got hit by a car on my very first call. It was just some guy not paying attention to where he was going, and he went right next to the ambulance where I was standing. So despite the fact that I was wearing all my safety gear and everything, it was the middle of the day and everything else. He barely just missed me. So make sure whenever you're on the road, you're wearing something that's reflective and safe there, the appropriate gear. We have to establish kind of a safety zone or like a danger zone around a motor vehicle accident for a number of reasons. If there's fluids leaking, if there could be a fire, if there could be explosion, things like that. We don't want to get hurt, and obviously we don't want our vehicles to get damaged. Also, if your ambulance gets damaged or catches on fire, well, now we got to take an ambulance from somewhere else that could be helping people somewhere else to come to this scene to help out your patient. So we want to keep obviously ourselves safe, but we also want to keep our vehicle safe as well. So around every collision, we'll have a danger zone. We have specific guidelines for each. When there's no apparent hazards, then we want the danger zone to be about 50 feet away from the accident in all directions. So if you're coming in and you're parking your ambulance, you want to be downstream of the accident, so past it, so the road doesn't get blocked for us, and we have room for the fire trucks and everything. But you want to go about 50 feet past it, right? And we're not going to have anything parked within 50 feet in all directions there. When fuel has been spilled, then we want 100 feet in all directions from the wreckage and the fuel. If the fuel is spilling and it's going downhill, then don't park downhill. You don't want gasoline to be running downhill, and then all of a sudden the gasoline catches on fire and it's running downhill towards your ambulance, that fire there. So yeah, 100 feet in all directions when there's been fuel spilled. When the vehicle's on fire, again, 100 feet in all directions. Uh, when wires are down, you're going to we have to make sure, one, that we're not going to get electrocuted for electrical wires being down. So you don't want to go into a scene like that. We have to get the electricity turned off before we get in there. So you want to go one full span of the wires away from the poles. Okay, so the pole in which that wire um, broke off of, I guess the pole that it's still attached to, rather, one full span of that in all directions. So however long that wire is, if you take it from wherever it's attached to, and you make a circle around it for whatever the length of the wire is, that's how big our safety zone should be. So should that wire be live with electricity and sparking and moving around, we're going to be outside of the zone where that wire could go. If it broke off of, there's two poles and it broke off of this one, then however long that wire is in a circle around the pole that it's still attached to, that's how far we want to be out from it, or at least that far there. So one full span of wires away from the poles in all directions. When hazardous materials are involved, we're going to use the ERG, the Emergency Response Guidebook. Those are those orange books that we see on the bookshelf close to our door in the classroom there. When we get into our hazardous materials chapters, we'll learn how to use those. Crime scenes and acts of violence. We can definitely go to places where violence has occurred or where it's still currently happening. So we have to keep an eye out for threats of violence. When we get there, like, are we hearing fighting? Are we hearing loud noises? Do we see weapons that are visible or in use? Or somebody carrying guns? Or they have knives? Do they have knives? Do they have baseball bats, crowbars, whatever it might be? There, do we see any weapons? Any alcohol, drug use there? An unusual silence can even be a sign, right? We all know the saying from movies like, it's quiet. It's too quiet. Well, pay attention to that. Something may be going on that we can't see at first. It's not really readily apparent. So keep that in mind. Another thing here, like you're going to want to trust your gut. Okay. We may not be able to see something, but maybe we just don't feel comfortable. Something doesn't feel right. Something feels like it's going on. Trust your gut. You can always back out of an area or the scene to make sure that we're safe and get law enforcement in there to clear the scene to make sure that it's safe. Remember, our priority, our number one priority at all times is our safety. It's never the patient's. So it's always ours. So, if you get hurt, then now we need a crew for the patient and a crew for you. So the resources spent on the scene just tripled if you get hurt. So you're there, and we're going to need two more crews there as well. So, and obviously you want to go home. You want to go home at the end of your shift. So pay attention to your gut. If you feel like it's not safe, then back out of there. If you've been to a scene before and there's been violence there before, it can be an indicator that there's going to be violence there this time. So keep an eye out for these kind of things. Again, we can always back out. We can always say, we're going to go stage a block down the road and around the corner for police to come and clear the scene. Let's talk about standard precautions. We've talked about this many times. Standard precautions, first and foremost, are going to be our lines of protection against things. So body substance isolation, these are our gloves, our goggles, our masks, things like that. And then PPE, you might have like bunker coats, reflective vests, helmets, like thick gloves for helping to go into a car that's been, there's glass broken and things like that, or jagged metal. So always wear that kind of stuff. Keep yourself safe at all times. We've talked about my preferences for BSI, and that is, just to make it clear, there's no point in ever getting off an ambulance when there's a patient involved. There's no point in getting off the ambulance without your gloves on. Always just be ready to go. Have your gloves on. Obviously, we're wearing masks at all times also, but always just at the very bare minimum, have your gloves on when you get off the ambulance. Be ready to go. Okay, so we've talked about standard precautions and safety, right? A couple of our items from that box, right? BSI, is the scene safe? Yes, the scene safe. Now we got to figure out what the nature of the call is. What's the illness, or how are they hurt, right? So why have we been called there? We start with mechanism of injury. Remember, mechanism of injury is how they got hurt, basically. So if you have a patient and they fell down the stairs, well, how did they get hurt? They fell down the stairs. What's the mechanism of injury? They fell down the stairs. Okay, so that's the easiest way to understand mechanism of injury. Nature of illness is the reason we're called there. It's not how they got sick, it's what sickness they're experiencing. So if it's basically the reason that you were called there. So why were you called? They're having trouble breathing. What's the nature of illness? They're having trouble breathing. Why were you called? They're having chest pain. What's the nature of illness? Chest pain. Why were you called? It's a patient's having a seizure. It's the nature of illness. They're having a seizure. I think that's the easiest way to understand those. Now let's dive in a little bit to mechanism of injury here. Mechanism of injury is basically how they got hurt, right? And when people get hurt, forces are applied to the body. Force is applied to the body in some manner. So we have to try to figure out what those forces were and how they hurt the person. Understanding these forces can predict injury patterns. Like we talked about injury patterns the other day, and which the book does a good job of explaining. When there's a head-on collision, there's two injury patterns for the unsecured patient, or the patient that's not wearing a seatbelt. So they can go up and over the steering wheel, or they can go down and under the steering wheel. And as you can imagine, if somebody's going up and over, you can think about what parts of the car the body is hitting. Those are the forces, the force of the body hitting the steering wheel, or the head hitting the windshield. Those forces are applied to the body, and those can cause injuries. So understanding how the forces get applied to the body will help you to predict those injury patterns and what injuries you may be looking for and dealing with. You got to be careful using injury patterns. Now, it is helpful. However, there's a drawback. Your vision of what has happened to the patient, if you're solely thinking, you have to remain open to possibilities that you didn't think of. You can't be myopic and get tunnel vision and being, well, they went up and over, so these are the only injuries that they can suffer. That may not be the case. So you could find something that is unusual, or something that you didn't expect. So you have to keep an open mind. Injury patterns can help predict where injuries occurred on the patient, but it's not 100% all the time. It's just not. It's the way things are. So it can give you an idea of what you're looking for, but it's not like you can pull up in an ambulance, look at a car that's 50 feet away, and know that it's a head-on collision. You can't get out of the car being like, that's an up and over. I know this guy has head injury, neck injury, chest and abdominal injuries. Can't say that. You can have it in mind that that's maybe what you are going to deal with, but it's never a 100% predictor. So it just kind of gives you an idea of what you might be predicting. Okay, so when you're thinking about mechanism of injury, it's important to not become myopic or have tunnel vision there, right? And to be open-minded, so you don't miss things. We don't want to miss stuff there. Okay, so in talking about mechanism of injury, we have to understand that there's a few different types of forces involved that can be applied to the body. There is a direct force, and a direct force is it's like a direct blow to something. If you got hit by a baseball bat, that would be a direct force. So obviously that can apply to the body there easily. So we can see different parts on this picture here. If you have direct blows to, for example, her left shoulder, you have a direct blow there, then the injuries that we could see from that, clavicle injuries, scapula injuries, the shoulder girdle, basically the AC joint and the humerus there. If we have a direct downward blow, next to the head there, then we can have clavicle and scapula injuries. Down by the knee, direct blows like to the knee, like if somebody fell and landed on their knees, then we can have injuries that occur with the knee, hip, the femur, for very forceful for those, because obviously the femur is the strongest bone there. And then we can have indirect, or we'll go down the list here, the twisting injuries. So obviously, if you get a limb that gets twisted too far, obviously we can have injuries there. I think that's easy to explain. So like if we look down at our leg, twisting injury, if we have the bottom of the leg twisting, then that can mean that we've got injuries to the hip, the femur, the knee, the tib fib, the ankle, all the way up. Even if it's the foot that's getting twisted, those injuries can go all the way up because of obviously how everything's connected. We also have forced flexion and hyperextension. We all know what hyperextension is, right? I'm sure we've all probably at one point or another hyperextended our knee or something when we've been running around. Well, that can happen with any of our joints, hyperextending it. And flexion is the other way. So that's easy to see with like the neck rather than some of the other things. So hyperextension would be back like that with the neck, and hyperflexion would be down. So you can get to a point here, if you kind of push on your head, you can feel how it starts to get uncomfortable back here in your neck. So if you can imagine like a lot of force applied that way, that's how we can get those hyperflexion injuries. We also have indirect injuries as well. So like, for example, if your patient, let's say, jumped off a 3-story building, right? So they're 30 feet up in the air, they jump off and they land right on their feet. Well, that force is going to travel up their legs. So you could have injuries not only at the feet, right? That would be a direct injury. The feet is the part of the body that hit the ground, right? But that force will travel up. So a direct injury would be to the feet there, but the indirect injury will cause injuries somewhere else in the body, basically. So that force will travel up the legs. So maybe we have injuries in the ankles, the knees, femurs, the hip and pelvis up there because of the indirect force. So if this guy jumps off a 3-story building, lands on his feet, and he dislocates, he's got bilateral hip dislocation because of it, that is because of the indirect force. When we're looking for mechanism of injury, we're going to look for clues here at the scene. This is a good picture of it. If you look at this car, what do you think happened with this car just by looking at it? Well, we weren't there, so obviously we didn't see it, but we can tell by looking at this car. We've got scrapes. Let me see here. 1 second. All right, you can see here on the car, we've got all these scrapes, right? Along the door, the mirror on this door is gone. We have all these scrapes up top on the roof. The roof is kind of crunched in, and the way it's where this angle here is, right? This tells me that this car went over and the weight rested over here on the driver's side, crunched it in, that broke the windshield out and everything else. So this car, not long before this picture was taken, was on its roof, or at least on its side, and possibly on its roof there, and then it got rolled back over. So maybe this is a complete rollover. Maybe fire rescue had already turned it over there. So you can imagine just by seeing that, like, okay, that car was upside down. So what could have happened inside the car? Well, it's tough to see sometimes, but you can imagine if the patient was unbelted, not secured, that if that car was upside down, well, then definitely the patient was upside down. But were they bouncing around in it? That kind of thing. So, what kind of forces could be applied to somebody that's bouncing around in a car that's overturning? All right, so we can get forces applied to the head, anywhere on the body. Basically, they become like a shoe and a dryer, right? They're just bouncing all over the place inside of there. All right, more mechanism injury. So for motor vehicle collisions, we are talking about, as we talked about in class, we've got some injury patterns. So for head-on collisions, we've got the up and over injury pattern. So we can have injuries to the head, base, neck, chest, and abdomen. And for down and under injury patterns, we can have injuries to the chest, the abdomen from hitting the steering wheel, and the lower extremities as well. Here we go. We got all three of these. We can see we've got the up and over injury pattern here, right? Head is hitting the windshield, which causes hyperextension on the neck, right? And then we got the chest and abdomen down here to the pelvis, making contact with the steering wheel. Oops. On the other one, the down and under, all right, we've got knee making contact with the dashboard, the indirect force, putting forces back here, and the femur and the pelvis. We can also have contact here with the abdomen and chest with the steering wheel. Now, obviously, this is no airbag, so this is going to be less common than having an airbag there. Now, with an airbag, we can have facial injuries, broken noses, bloody lips, black eyes. When it expands, there's hot gases in there, and they leak out basically. And so we can have minor burns also to the wrists and to the face as well. There. Kind of hard to see, but you can see in this car, we've got some damage to the windshield. Now, this damage to the windshield, this looks like it came from this part of the dashboard that sprang up to release the airbag. Looks like that's what made contact with it there. It does not look like that was somebody's head or anything like that. So we're going to be looking at things like how the windshield is broken, things like that, looking for contact for stuff. For example, this windshield was damaged from the inside. We can see the hood of the car here. We can see the hood of the car. Whoops, that is, the hood of the car that's been banged up. So they hit something head on. And what we're seeing here is a starburst effect, or a spidering of the windshield, it's called. And you will usually see that when a head has made contact with the windshield there. So we'll be looking for clues. So if you see this, like, oh, I'm looking for head injuries. It's a nice clue for you. Rear end collisions will have some injury patterns there. Normally we're looking for neck injuries with that kind of thing, from people getting whiplash. So it's a hyperextension of the neck. Those problems, you get hit from behind and you get that kind of thing there. We'll get side impact collisions. You get broadsided or T-bone, so you can imagine the force being applied from the side. One with the neck, if it's applied to my right side, neck's first going to go this way, and then it'll go that way. So we have forces on the neck and the head. When I get hit this side, does the car get pushed in, hit my head as my head's going over? It's going to make contact with my upper body, my hips, things like that. How big was the impact? Are we going to have all that forces applied to that side of the body? Things like that, things to consider there. Rollover collisions, like I said, it's like putting a shoe in a dryer. If they're unsecured, they're going to be bouncing all over the place inside of the back there. So we could have injuries anywhere. So in those cases, the injury patterns that you're expecting is your long bone fractures, head and neck injuries. That's what we're expecting there. Internal bleeding as well. All right, let's take a look at this picture. This is a rear end collision. All right, so let's imagine that you're anywhere in this car. So if you're in the back seat, I mean, you know, do you survive that? I mean, look, you can see the wheel. Here's the wheel, and that is all the way up behind the driver's seat. That's a lot of force. A lot of force got applied to this car. So that means a lot of force got applied to the bodies inside the car. So I don't know if that back seat's survivable or not. Can't tell about the right side, the passenger side of that back seat, but that driver's side back seat, that's probably not survivable. Now, what if the person was driving alone and they were just in the driver's side? Well, a lot of force is going to be applied to the body still. For this person, we're thinking about head and neck injury. Absolutely, that whiplash from getting rear-ended like that, it's got to be tremendous. So, thinking about back injuries, head and neck injuries for this person here. Here's a T-bone crash right here, and we can see. I mean, this is, in order to do this to a car, this is just an unbelievable amount of force. Right? I mean, the car that hit this was moving at a very high rate of speed. You can see the skid marks from this car, right? This firefighter is just about to walk on one right there. And here's some other, I guess this wheel came off and it's been kind of put there, but and this is probably from the wheel on the right side of the car there. So this car, at least in this picture, was pushed about 15 feet or something like that. But is this survivable for the driver? You pull up to this and you see this. What are you thinking? What parts of the driver's body could be injured if they're alive in there? If it was me, I'd say, well, the entirety of the left side of the body is going to be injured. If you're the driver, we're looking at head injuries, neck injuries, internal bleeding, things like that. This is obviously a very significant accident. Here's a rollover picture. So let's assume that our patient is inside of here, but they're not belted, right? Again, they're just going to bounce around in there totally unsecured. And so you have to expect basically any injury: head, neck, internal bleeding, long bone injuries, soft tissue injuries, things like that. Let's see if we can watch this video here of this gentleman in his car. All right, as you notice, he's got no seatbelt on. Getting a little tired. Long day at work. Well, that gentleman, let's watch that again, shall we? All right. This is not the smallest of people. And how easily did he just fly all over that car? Pretty simple, right? For him to just, I mean, he's a big dude. For those of you that think that, I'll see it coming and I'll put the seatbelt on before it's coming, I think this can show you that that's not an effective manner to keep you safe. It's not an effective strategy. All right, so let's watch this again. We got this guy. What kind of injuries? He's obviously in a rollover here, right? Or at least onto its side. So what kind of injuries do we think we're going to get here? Whoops. All right, so here's how our guy ends up. If you notice that he hit the dashboard first, possibly the windshield, definitely the steering wheel, and then the car started rolling, and he bounced all over the place there. You know, ceilings crushed in there a bit on the passenger side. He's obviously in the back there. So this could obviously be significant in the injuries that he has there. So this is just showing you that if somebody's unsecured, you can have all sorts of type of injuries, including death. I don't, to my knowledge, this gentleman survived, but look how easy it could have been for one of his arms or his head to go out that window and then have the car rest on top of it. You know, that happens. People get crushed by their own cars when they get tossed out of them sometimes. So for these rollover injuries, the unsecured patient, any type of injury, we have to be keeping a lookout for. So there's also rotational injuries. So oftentimes cars get hit on the side, you know, on the front or the back of the side, and it rotates the car. And in doing so, it puts these horizontal forces upon the body. And so we can have, you know, additional impacts basically of the patient inside the car, subsequent impacts there of the patient inside the car, or other objects outside. A car gets spun in an intersection and spins over into another car, a wall, a telephone pole, something there. So there may be more than one impact because it's being basically spun and sent off course. All right, falls. Falls happen all the time. For adults, we need to be worried about a fall of greater than 20 feet. That is a significant fall and requires a trip to a trauma center, not just a local hospital, but a trauma center. The farther you fall, the faster you go, and up to a point, obviously. But if you're falling from 20 feet, you're moving pretty quickly when you hit the ground. So that's a lot of force applied to the body. And so we can have injuries all over the body, from broken bones to head and neck injuries, to soft tissue injuries, internal bleeding, all sorts of great stuff there can happen to the patient. So falls more than 20 feet, that requires a trip to the trauma center, not just your regular old hospital. Children, and we're going to say they're under 15, more than 2 times their height. Okay, 2 to 3 times their height, excuse me, or more than 10 feet. That's a long ways for little kiddos. I mean, if my kiddo's 3.5 feet tall, about, and if she fell 10 feet, that's about 3 times her height. That's a long ways. Just imagine that. It's the height of a basketball rim. So you put a child up there and they fall off of it. That is a long ways for them to fall. So that's a lot of force being applied to their body. So for adults, anything 20 feet or greater, kids 10 feet or 2 to 3 times their height. These falls require trips to the trauma center. So when we're looking at things for a patient that fell, we're going to be looking for clues, right? So where could he possibly have fallen from? What did he land on? Did he hit anything on the way down there? How did they land? What part of their bodies do we think hit the ground first and took the brunt of the impact? So a lot of things we got to think about with a fall. And a lot of times we can get clues just from looking at the scene. So for falls, the mechanism, some important factors that we gotta keep in mind, like we talked about here, is the height of the fall. How far did they fall? What did they fall onto? Like, did they land in a big pile of, watery, fluffy mud? Or was it grass? Was it a wood floor? Was it a carpeted floor? Was it concrete? Did they fall onto stairs? And so they hit, all these corners, their body came down on the corners like that. What did they fall onto? that's going to tell us a lot. Like, a person that falls from 10 feet straight onto their back into a big mud puddle, maybe they're totally fine. But a person that falls from 10 feet onto stairs, they're going to be messed up, right? So the surface in which they fall onto is really important to note. When that old lady fell at home, did she fall onto the nice carpeted bedroom floor, or did she fall and hit her head on the tiled floor in the bathroom? That's a big difference, right? What part of the patient hit the ground or hit whatever that they landed on? What part of it hit first? That's going to take a lot of the brunt of the direct force. And in seeing which part hit first, could there be indirect forces caused later? Did they land on their feet, which broke their feet or ankles? And then did they have problems up the lower extremities? Do we have knee problems? Do we have hip problems because of the indirect force? So what part of the patient hit first? And did anything interrupt the fall? I mean, that means, did they hit anything on the way down? So the old lady that falls in the bathroom, she bagels out, right? She loses oxygen supply to her brain, blood supply to her brain goes down because she bageled out. She passes out. Does she hit her head on the sink and then the floor? Does she hit herself on the door frame on her way down, and then she spins, and her hips come down in the bathroom on the tiled floor, but her head lands in the bedroom where it's carpeted? Did the guy that was cleaning his gutters up on his roof, did he fall from the roof and hit the railing of his porch on his way down, and then he hits the ground? Obviously, these are, hitting things on the way to the ground can obviously cause injuries as well. So what did they hit on the way down? Anything that interrupted the fall at all? All right, penetrating trauma. This is when an object obviously penetrates the body, so it goes through the skin and into other tissues there. And we talk about these, we classify them by how fast they entered the body. So there's 3 types of penetrating injuries, and they're all classified by how fast they entered the body. All right, so for as far as classifying those, we have low velocity injuries. This is going to be like your stabbings, so knife injuries, that kind of thing. With these, the injuries are going to be directly along the path where that blade passed into the body. All right, we're not going to have injuries elsewhere. It's just going to be along that path where the blade traveled. So it's limited to that area. Now there could be multiple wounds, multiple stab wounds, that kind of thing. Medium velocity is going to be handguns, shotguns, arrows, and high velocity is going to be rifle injuries, and they could be anywhere on the body. One of the difficult things about GSWs or gunshot wounds is that they don't always travel. The bullet doesn't always travel in a straight line once it enters the body. It can change direction multiple times. Not only can it change direction, but it can fragment. It can turn into smaller pieces, and each of those pieces takes a path, and obviously there's injuries resulting all along those paths. You could literally have somebody that's shot in the arm, the bullet comes across and hits them in the arm like this, and it takes a turn and comes out their lower leg, right? So everywhere along that path, there's injury where it traveled there. So they're tough to in the field sometimes get a sense of what exactly is injured. We have to basically assume that it was not a straight path that the bullet traveled. And you're not always guaranteed an exit wound. Well, it came in here and it came out here. Well, maybe it stays in the body. Maybe it never came out. And speaking of entry and exit wounds, we're not crime scene investigators or anything like that. So we need to hesitate in saying that something is an entry wound versus an exit wound. If we really want to know that kind of stuff, we can take Mr. Quick's criminal, or take the criminal justice program over here at Tech. So we need to keep that in mind. The bullets won't always travel on a straight path. That injuries can be almost anywhere in the body because of a gunshot wound. And again, they don't always travel on a straight path. So with those medium and high velocity, obviously we have damage directly from the projectile, whatever the projectile hits and whatever path that it takes through the body. But we also have what's called pressure injuries, what's called cavitation. What happens here is the bullets are moving at such high velocity, such a high speed, that there's a pressure wave around them. It's pushing the air around it, and that pressure wave actually causes a lot of injuries. So to understand what I'm talking about cavitation, we have this video to watch. There is something called ballistics gel. And ballistics gel, as you can see on the screen, it's this clear gel, and it simulates basically flesh. It's got the same kind of resistance to flesh, and so we can watch these videos and assume what's happening in the body. This is what happens basically in the body. So what we're going to watch here is a high velocity bullet. So this is from a rifle going through a ballistics gel. And you're going to see that the path that it takes isn't as small as the bullet, right? It's not just the little tiny path that's the same as the bullet going through the body. So check out what the pressure wave does as the bullet's going through. I'm gonna find my spot. All right, I had to fast forward it there to get it to the right spot. So watch this. Here's the bullet. This is in super slow motion. We can see the bullet here about to enter the ballistics gel. Okay, so pay attention to like the pathway that the bullet leaves behind it. Okay, it's not just, again, like I said, it's not just that big. Like the bullet's that big, that's its diameter. That's not necessarily diameter of the wound channel. So check this out. Watch what happens. And again, this ballistic gel simulates what flesh is like. I'm going to pause it right there. So look how big this wound cavity got inside. This is pushing the person's guts around, their flesh around, destroying tissue on its way through. So that's not just a couple of millimeters, how big that bullet is. That's much larger going through the body. We can also see that the bullet fragmented in there. You can see different parts of the bullet all over the place, and those fragments are taking their own path through the body, tearing and ripping and damaging tissues that it goes through. All right, let's continue watching this. Look how big that gets. And the rapid decompression there builds up the pressure, and pressure heat ignites that little bit. You're going to see smoke coming out of this in a second, out of the wound channel. There you go. So that's cavitation. So when a bullet, high speed, high velocity bullet goes through somebody, this is what's happening inside the body. It's not, again, not just that little channel that the bullet travels through. So I think this is a good example of the force and the destructive nature of a high-speed bullet. So we're talking about, Winchesters, 30-30s, the Winchester Magnums, 30-30s, AR-15s. Um, that's what happens in the body when one of those bullets traveling at such a high speed passes through it. So it's important to recognize that, again, those bullets are only a couple of millimeters in diameter, but the wound channel they create can be very big. Right? Everything around that in that pressure zone where everything is cavitating and expanding like that um, is suffering damage there. So it's important to recognize that that's what's going on when somebody gets shot. Right? Again, it's not just the path that that little piece of metal traveled. All right, and then we got to talk about blunt force trauma. This is getting hit with something that's not cutting or not penetrating there. So getting hit with a baseball bat, a 2x4, or something like that. So it doesn't penetrate the skin or other tissues there as well. Signs can be subtle and often overlooked because they're going to produce bruising, and oftentimes that doesn't show up right away. It may be quite a bit before we see some. So depending on where it is. So, let's say somebody has blunt force trauma to like the liver, and it starts bleeding. So maybe it's 10 minutes, maybe it's 15 minutes before you start seeing the signs of that, after the accident. And maybe it's longer than that. So we have to be vigilant in checking and rechecking to see if any signs are developing for blunt force trauma, internal injuries, things like that. So here's a definition that we'll need to know. It's index of suspicion. It just means being suspicious about things like if somebody's in a rollover accident, then I have a high index of suspicion that there's going to be multiple injuries. This is going to be a multi-system trauma, right? We might have head and neck stuff. We're going to have long bone injuries. We could have internal bleeding, internal injuries, things like that. And so just be suspicious that maybe there's more, that there's more there. It's not always just what we see, because sometimes it doesn't show up for a little bit, some of these internal injuries. So maintain a high index of suspicion that there are more injuries. And maybe we can figure this out by seeing skin condition or mental status changes, right? Maybe they're bleeding internally and that we're not quite seeing the signs outwardly of it yet, like bruising, but maybe we can see signs of compensation. The heart rate's going up, the respiratory rate's going up, altered mental statuses due to a lack of oxygen from a lack of blood getting to the brain, things like that. So if we start seeing things like that, then we have to be suspicious that something's going on in the body, right? The body doesn't just compensate for no reason. There's something going on for those mechanisms to become engaged. So we have to maintain a high index of suspicion, especially for blunt force trauma, because it doesn't show up like right away, like penetrating trauma is. Like we're gonna see the hole. That hole gets made immediately when as soon as the body is penetrated. Not necessarily the case here with blunt trauma, blunt force trauma. Maybe it takes a bit for us to see that. So again, keep your antenna up, maintain that high index of suspicion. All right, nature of illness. This is the reason why we're called. We know this. It's why they're sick, or why they called. It's not how they got sick. It's just what they're sick with. What is the issue they're dealing with right now? So it could be trouble breathing, chest pain, diabetic emergency, seizure, mental. It could be a mental health emergency. There's any number of reasons for it to be a medical reason, but we can use a lot of times some things in scene size up at scanning the scene for it for things, but sometimes it's just it's in our dispatch information, or we'll have to ask the patient, what's going on today. It may not be readily apparent there. So this scene here, we got a guy sitting on the sidewalk or the grass on the sidewalk and his bike's laying down. I mean, just seeing that, I have no idea what happened in this picture, but maybe it's that he fell off his bike. So just taking some information in from the scene. But with medical stuff, it may be more difficult to determine what's going on just from looking at the scene. There may not be anything. You might walk into somebody's house and everything looks to be just fine, but they're having a diabetic emergency, right? But there's nothing in the house, nothing that you can see readily, or when you pull up in the neighborhood or to the home, or once you get inside the house, that's going to say, oh, this is a diabetic emergency. Maybe we have to talk to somebody, or maybe we have to do the detective work in our patient assessment to figure it out. So again, the information could be obtained from the patient, family members, or bystanders, or the scene itself. Moving through our scene size up. We've talked about scene safety, our BSI, mechanism of injury, nature of illness. Now, again, what we're talking about is number of patients and the need for additional resources. So do we need extra help? How many patients are present? Goodness gracious, could you imagine going on a call and missing a patient? You know, you just think it's one person in a rollover accident, but a second person wasn't belted in and they got tossed out of the car and they're in their bushes and you didn't know about that. And the first patient, maybe they're unconscious or they have an altered mental status, so they can't tell us that there was somebody else there. Gosh, could you imagine that? So we've got to figure out how many patients are present. And then do we have the enough tools on hand, and what I mean by that is people to help do the job, or actual physical tools to do the job to care for all the patients. What if you're called out to a motor vehicle accident, but that car happens to be 20 feet down an embankment in the woods on top of on its roof, and you know it's just you and somebody else in the ambulance? Do you have enough resources for that? No, probably going to need manpower, so we're going to get fire department there. Maybe the accident is severe enough where they need to be flown, so we get a helicopter there. Maybe we need the police there to control traffic flow so we can work safely. You know, things like that. So we can always get help. We're EMS. We have a big team and lots of resources. So basically, if you can imagine it for the help, we can get it. You got power lines down, you need the power company to come shut it off, get it shut off. You got a train car that spilled over, we can get the train company to tell us what was in there. If we can't find the material safety data sheet or the shipping packages, their information there as well. So we can get just about help of any kind that we need. So don't be afraid to ask for it. And again, we've talked about this in class. Call for the resources early. If you think you need them, call for them. There's nothing wrong with calling for somebody and then not needing them. So call for them early. They can always be sent home. It's part of the job, right? Like we go on fire calls all the time. Like if there's a house fire, there's going to be EMS there. We may not do anything at all, but just in case, we're there in case we need to take care of a firefighter, or if there's a patient there that got dragged up. So like we get called for these things and they can too. So don't ever worry about calling for somebody and not using them. Okay, that's fine. It's part of the job. Everybody knows it. Part of the gig. So call for resources early, and don't be afraid to use them. And so here's some situations where we may need specialized training and equipment for help on a scene. All right, that's it for the chapter there. Please keep going through your medical assessment skills sheets. All right, keep practicing your scene size up part. Get your dialogue down for that. Basically, this chapter is all about that part when we're rolling up to a call, when we're getting to a call, and we're just gathering information right before we start our patient treatment. So this is, keep talking about how much I love the detective work of being an EMS and figuring out the mysteries of what's going on. And this And our scene size up is the first chance we get to gather any information and start putting that puzzle together of what's going on. If you have any questions, obviously shoot me an email or ask me in class there. But there's your chapter 11. And we'll see you very soon here for our chapter 12 lecture as well. All right. See you soon, guys.